So when you think of CVS, what's the first thing that pops into your head? For most of us, it's that store in the corner, right? Where you grab a prescription, maybe some snacks. But that's really just the tip of a massive healthcare iceberg. Today, we're going to peel back the curtain on CVS Health's 2025 financial report to find out what's really going on with the giant behind the storefront. So that brings us to the big question for this explainer. How did this sprawling company actually perform last year? Well, the answer, as you're about to see, is kinda complicated. All right, let's just start with a number that sets the scene. In 2025, CVS Health pulled in a staggering $402.1 billion in revenue. I mean, to put that into perspective, that's more than the entire economy of a lot of countries. It's just a massive number. So how did they get there? Well, that huge number comes from a company that wears a whole lot of different hats. So to really get what's going on, we need to look at the overall report card first. Think of this as the 30,000-foot view before we start zooming in on all the different pieces. Okay, let's break these numbers down. As you can see right here, total revenues and what's called adjusted operating income are both up, and up nicely from 2024. But here's the puzzle. Take a look at the two numbers for earnings per share, or EPS. The GAAP diluted EPS is way down, but the adjusted EPS is way up. So what is the deal with these two completely different stories? This brings us to a really crucial point. GAAP. That's the official by-the-books accounting number. And it got hit hard by some big one-time charges, like a $5.7 billion goodwill impairment. Now, adjusted is the story the company wants you to see. They basically remove those unusual items to show how the core business is performing day to day. And for anyone watching the company, this difference is critical. In this quote right here perfectly explains why they prefer that adjusted number. From their point of view, not only was it a good year, they actually beat their own forecast by a solid 15%. This is the headline they want everyone talking about. Okay, now let's zoom in on the first of CVS Health's three massive businesses, the insurance side, which you probably know by its brand name, Aetna. So this part of the company is your classic health insurer. It manages plans for over 26 million people. We're talking everything from doctor's visits and prescriptions to dental care and mental health services. It is a huge, huge piece of this puzzle. Now, to understand how this insurance business is really doing, you have to know this one key term, the medical benefit ratio, or MBR. Just think of it like this. For every single dollar in premiums that Aetna collects from you, the MBR is how many cents it actually pays out for medical care. So, from the company's bottom line, a lower MBR means they're more profitable. And here's where things get interesting again. The end of the year was actually pretty tough for the insurance business. They posted a significant loss, and that was because medical costs were just higher than they expected. But if you look at the full year, it was very profitable, with income up over $2.6 billion. It just goes to show you how one quarter doesn't tell the whole story. Okay, let's move to the next segment. This is the part of the business that's probably the most powerful, and also the one people understand the least, health services. The heart of this segment is a giant pharmacy benefit manager, a PBM called Caremark. Now, a PBM is basically a middleman that negotiates drug prices in bulk, and this role is hugely influential and, often pretty controversial because they play a massive part in deciding the final price you end up paying for your prescriptions. And when I say this thing is giant, I really mean it. In 2025 alone, this one segment processed nearly 1.9 billion pharmacy claims. Just let that number sink in for a second. That's the mind-boggling volume of prescriptions flowing through their system. So this quote is really the key to how this segment makes money. Improved purchasing economics is just a fancy way of saying they negotiated better deals with drug companies. And that helps them control costs for their number one client, their own insurance company, Aetna. It's a perfect example of how all these different parts of the company work together. All right, let's zoom in one last time to the part of CVS Health that every single one of us recognizes, the actual retail stores and pharmacies. Yep, this is the familiar face of the company. It's their 9,000-plus stores where you get your prescriptions filled, get your flu shot, and buy everything from bandages to birthday cards. And let me tell you, business at these stores was absolutely booming at the end of 2025. This chart shows same-store growth, so it's only looking at stores that were open for more than a year. Pharmacy sales shot up over 19%, and that was driven by a nearly 10% jump in the actual number of prescriptions they filled. That is some seriously strong growth. So you might be wondering, where did all that new business come from? Well, a big chunk of it was a very strategic move. CVS bought up the prescription files from their competitor, Rite Aid, as it was going through bankruptcy. It was basically a direct transfer of customers and their prescriptions right onto CVS's books. Okay, so we've looked at the big three parts of the company: the insurer, the middleman, and the storefront. Now, let's zoom back out and see what all this means for the year ahead. For 2026, CVS is pretty much holding steady on its forecasts for revenue and that all-important adjusted EPS. They still think they're going to earn between $7 and $7.20 per share. The one change worth noting is a slight downgrade to their forecast for cash flow, which they say is mostly just due to the timing of some payments. So, how does the company see all of this? Well, the CEO, David Joyner, framed these results as proof that their grand strategy is working, that they're using all these different interconnected businesses to change how we all experience healthcare. And that brings us right to the company's official mission. After everything we've just walked through, the mind-boggling complexity, the astronomical numbers, all the different divisions, their stated goal is simply this: to simplify healthcare. Which really just leaves us with one final and, I think, crucial question. We've seen a financial behemoth that's an insurer, a pharmacy, and a powerful middleman all rolled into one. So the question is, can a company that is this complex, with so many moving parts and so many competing financial pressures, truly deliver on that simple but incredibly difficult promise to the customer?